Welcome back to the channel where medical topics are made simple. Our videos give you memory tricks to help you out. And today you'll learn a simple memory trick to remember meningitis signs, including the Brudzinski sign versus Kernig sign. This video is a teaching from our Teach Me Medicine book, which will be linked down below, where you can also find more information on this topic. There are two signs of meningitis that you need to know for physical exam. The first is Brudzinski sign. The memory trick for this is to take the BR at the beginning of Brudzinski to remember the word bring. Bring starts with BR. And then take the KI at the end of the word Brudzinski to stand for knees in. This will help you remember the phrase bring knees in. This is because Brudzinski sign is when the patient brings their knees in when the neck is passively flexed. In other words, passive neck flexion causes the patient to flex their hips and knees or bring their knees in. The second sign of meningitis is Kernig sign. The memory trick for this is to take the KE at the beginning of Kernig to remember the phrase knee extension. This is because Kernig sign is when the patient has spinal pain or resistance when the knees are passively extended. In other words, there is spinal pain or resistance with passive extension of the knee when the hip and knee are in a flexed position of 90 degrees. So the patient is supine and their hips and knees are flexed 90 degrees, and when the knees are passively extended, it causes spinal pain or resistance. And these signs make sense with meningitis. What happens with Brudzinski sign is that the meninges are stretched when the neck is flexed. And remember, meningitis is inflammation of the meninges, so the meninges are inflamed and irritated. So when the meninges are stretched, this causes the patient to bring their knees in to relieve pain. In Kernig sign, it's similar. The irritated meninges and nerve roots are stretched when the knee is extended, and this causes spinal pain or resistance. So again, these signs of meningitis make sense if we look at the definition of meningitis, which is inflammation of the protective membranes covering the brain and spinal cord. And these protective membranes are called the meninges. So meningitis is inflammation of the meninges, and this is typically caused by an infection. Brudzinski sign and Kernig sign both stretch the inflamed and irritated meninges, leading to the positive sign. If you found the memory trick useful, please hit that like button and leave a comment. Subscribe to save time studying and not miss out on future videos and notes. You can find all of our study guides, flashcards, and book linked down below. Thanks for watching and hope you return for future videos.